Dispo-Fix. This basic disposable aluminium external fixator can be used for a variety of indications. The set comprises a 12mm aluminium rod, 4 gold-colored clamps, 4 5mm cell drill shank screws, and 1 connecting bar if a second frame is required. An 11mm combination wrench is also necessary. The clamp components must be correctly assembled to accommodate the rod and shank screw. The cell drill shank screw is designed with a drill, a tap, and a screw. This allows one-step insertion of the shank screw, ensuring a good bone-screw interface which reduces the risk of pin track infection in the clinical setting. The shank screws may be inserted using either of the hand drills or the universal chuck with T-handle. For this exercise, we will use this hand drill. The fracture is reduced and locked in the vise. The appropriate insertion point and direction for insertion of the first shank screw is selected that is medial to the tibial tuberosity in a lateral direction. The shank screw must be inserted in both cortices, but the tip should not penetrate the far cortex. A change in resistance may be felt once the second cortex is reached. Note the optimum position of the shank screw. The bar assembly is prepared with 4 clamps and mounted onto the first shank screw. The clamp is then tightened using the combination wrench. The second shank screw is inserted distally in the distal fragment using the clamp as a guide, and the clamp is tightened. If a second bar is going to be applied, then the shank screws must be inserted parallel to each other. Both clamps are now loosened to allow final manipulation of the fracture. The bone is released from the vise and reduction is carried out. The clamps are then retightened. The bone is repositioned in the vise for completion of the exercise. The 2 remaining shank screws are inserted through the clamps as proximal to the fracture as possible, approximately 2 centimeters, to provide maximum stability. The closer the frame is to the bone, the more stability it provides. All clamps are then retightened in sequence. This unilateral single bar frame, used for the correct indications, will provide adequate stability for many fractures and soft tissue injuries.